As with other neurodegenerative diseases, symptoms are progressive. So they start mild and in most individuals get worse over time. So they may begin with problems with mood and behavior. So things like aggression, having a short fuse, being disinhibited or impulsive. It may also begin with symptoms like depression or anxiety. In other individuals, those mood and behavior symptoms don't ever show up. And the first symptoms tend to be cognitive symptoms like memory problems, forgetting recent conversations, misplacing objects, or executive function problems, difficulty with multitasking or problem solving. Regardless, especially with the cognitive symptoms, we see a progressive course that in many individuals becomes dementia, where there is not only impairment in cognition, but there's also impairment in daily function, in activities of daily living.